Welcome to your deep dive. Today we're going to be looking closer at glaucoma treatments, specifically what's out there beyond eye drops. We got the chance to consult with Professor Dr. Suhail Sarwar, a renowned eye surgeon from Lahore, Pakistan, doing some really groundbreaking work with a therapy called micropulse therapy.
It is a fascinating field, lots of innovation happening. But before we get into the really out there treatments, let's make sure we're all on the same page about what glaucoma is and why it even matters.
Exactly. A little glaucoma 101 never hurts. It's one of those conditions we hear about, but might not totally grasp. Can you give us like the layman's explanation?
Okay, so think of your eye like a delicate plumbing system, okay? Fluid constantly flowing in and out to maintain its shape and, its health. Glaucoma occurs when that drainage system gets clogged, causing pressure to build up inside the eye.
And that's bad because
That pressure puts a strain on the optic nerve, which transmits visual information from your eye to your brain. Imagine a cable carrying high-definition video signals gets pinched or damaged. Picture quality suffers.
Ooh, that makes sense. So high pressure equals a blurry or distorted signal to the brain. And I've heard that glaucoma can be sneaky, right? You might not even realize there's a problem until damage is already done.
That's unfortunately true. It's often called the silent thief of sight. Early symptoms can be very subtle. You might experience slight peripheral vision loss or have trouble adjusting to dim lighting, but a lot of people don't notice anything until significant damage has already occurred.
Oh, wow. That is a scary thought. It highlights the importance of those regular eye exams, especially as we get older.
Absolutely. Early detection is key. Catching it early can slow or even halt its progression. Speaking of treatment, let's talk about those eye drops you mentioned.
Right, because those are usually the first line of defense. Our listener today wants to explore what else is out there. So can you quickly explain how those eye drops even work, just to lay the groundwork?
Sure. So eye drops aim to lower the pressure inside the eye. We call intraocular pressure. Some drops work by decreasing the production of fluid in the eye, like turning down a faucet. Others improve the outflow of fluid, unclogging a drain.
So different drops, different mechanisms. Got it. But I have to admit, remembering to use eye drops multiple times a day seems like a hassle.
It's a huge challenge. Patient compliance is a major hurdle with eye drops. Studies have shown that many people struggle to stick to their prescribed regimen, which can lead to, serious consequences.
And those consequences could be.
One study we looked at put it rather bluntly. Non-adherence to topical glaucoma therapy remains a major cause of therapeutic failure and progression to more serious intervention.
Okay. That's a serious wake-up call. Skipping those drops could mean facing more invasive procedures down the line.
Yeah.
So let's talk about those other options. What about surgery?
Traditionally, glaucoma surgery was a pretty big deal. Invasive, lengthy recovery. Thankfully, there's been a real shift towards minimally invasive procedures.
Ah, that's where those futuristic treatments come in. I know our listener is eager to hear about those.
Exactly. One of the most promising is minimally invasive glaucoma surgery, or MIGS.
MIGS. Okay, now we're talking. That sounds much more appealing than traditional surgery.
It is. MIGS procedures are designed to be less invasive, using tiny incisions and implants to improve fluid drainage. Think of it like a tiny bypass for your eye's plumbing system.
A bypass. So instead of trying to unclog the existing drain, you're creating a whole new pathway.
Precisely. And these implants are incredibly small. We're talking microscopic tubes, like the iStent and iStent inject, inserted into the eye to facilitate outflow.
Wow, that's some seriously impressive microengineering. Are these procedures effective?
Showing very promising results. For example, a study on the iStent inject found that it significantly reduced both eye pressure and reliance on medication in patients with open-angle glaucoma.
That's fantastic news. Less reliance on eye drops and lower pressure? It's a win-win.
It is. And it highlights the direction glaucoma treatment is heading, towards gentler, more targeted approaches. But there's another technology that I think you'll find even more fascinating, closely related to the work Professor Dr. Suhail Sarwar is doing. Micropulse therapy.
Ah, yes. Micropulse therapy, that was one of the things that really caught our listeners' attention. Can you tell us more about it?
Micropulse therapy utilizes a very unique type of laser. Instead of continuous beams that can sometimes cause collateral damage, it delivers incredibly short bursts of energy. These micropulses target the ciliary body, the part of the eye responsible for producing fluid.
Just like a super precise laser scalpel, targeting the source of the problem.
Exactly. This precision is what makes it so exciting. minimizing damage to surrounding tissue. It offers a safer and potentially more effective way to modulate fluid production and lower eye pressure.
And Professor Sarwar is a pioneer in this field, right?
Yeah.
What kind of results is he seeing with his patients?
He's achieved remarkable success in lowering intraocular pressure and improving fluid drainage. But it's important to note that while the results are promising, micropulse therapy is still relatively new. More research is needed to fully understand its long-term effects and potential applications.
That's understandable. New technology always comes with a learning curve. But the potential here seems huge.
It is, and we're just scratching the surface. There's another cutting-edge technology that's changing the way we diagnose and monitor glaucoma, visible light optical coherence tomography, or VIS-OCT for short.
VIS-OCT. Okay, now this is where it really gets interesting. We're talking about a whole new way to look at the eye.
VIS-OCT goes beyond traditional imaging. To actually measure the oxygen levels in your eye, this is crucial because reduced oxygen supply to the optic nerve is a key factor in how glaucoma progresses.
So we're not just seeing the structure of the eye, we're actually seeing how well it's functioning at a microscopic level. That's incredible.
Exactly, and the implications are huge. Think about it. We may be able to detect glaucoma even earlier, before any vision loss occurs. Imagine identifying those at risk and intervening before any damage even begins.
That's the dream, isn't it? To catch it early and stop it in its tracks. But what about those folks who are already dealing with glaucoma? Are there any advancements that could help them manage their condition more easily?
Absolutely. Remember how we talked about the challenge of sticking to those daily eye drop routines? Well, there's a new treatment that could make life much easier for many patients. It's called the bimatoprost intracameral implant.
Okay, that name's a mouthful. But I'm intrigued. What's it all about?
It's a tiny device, implanted during a minimally invasive procedure that slowly releases medication over time. We're talking consistent treatment for up to 2 years, no more juggling bottles or remembering multiple drops a day.
2 years, that's game-changing. It's like having a miniature pharmacy bill right into your eye.
It really is a remarkable innovation. Studies have shown it's highly effective in lowering eye pressure and reducing reliance on those topical medications. It's even been approved by the FDA, and we're seeing really positive real-world outcomes.
So this implant could potentially revolutionize how people manage their glaucoma. That's incredible. But, while we're focused on these cutting-edge treatments, I think it's important to acknowledge the impact glaucoma can have on a person's overall well-being, not just their vision.
You're absolutely right. There's a strong link between glaucoma and depression, which often gets overlooked.
It makes sense, though, doesn't it? Vision is such a fundamental part of how we experience the world and connect with others. Losing that can take a toll on anyone's mental health.
Precisely. A nationwide study in Korea found that people with glaucoma were at a significantly higher risk of developing depression, and that risk increased with the severity of their vision loss.
That's really heartbreaking. But it highlights the need for a more holistic approach to glaucoma care. It's not just about treating the physical symptoms. It's about supporting the whole person.
I couldn't agree more. We need to address the emotional and psychological needs of patients alongside medical interventions, support groups, therapy, even mindfulness practices. These can all play a vital role.
It's about creating a network of care. Recognizing that living with glaucoma is about more than just eye pressure and visual fields. It's about navigating the emotional and social challenges that come with the condition.
Absolutely. And that brings us to another crucial aspect of care: communication. Clear and open communication between doctors, pharmacists, and patients is absolutely essential for ensuring safe and effective treatment.
I can imagine things could get lost in translation, especially with all the complex medical jargon surrounding glaucoma.
It's a real concern. One study we came across highlighted a simple yet brilliant solution: the glaucoma information card.
A card. I'm curious. Tell me more.
It's a tool designed to bridge the communication gap between ophthalmologists and pharmacists. The card clearly outlines the patient's specific type of glaucoma, which is crucial because different types require different management strategies.
So if a patient ends up in the hospital, for instance, the pharmacist can quickly and easily understand their glaucoma situation and avoid any potentially harmful drug interactions.
Exactly. This card helps ensure that patients receive appropriate and consistent care, no matter where they are. In the study, it actually helped prevent unnecessary medication restrictions for patients with open-angle glaucoma, the most common type.
Wow. That's a fantastic example of how a simple tool can make a world of difference.
Mm-hmm.
It shows that even small innovations can have a huge impact on patient care. But let's shift gears a bit and delve back into the science. I know our listeners are curious about the latest research, particularly the genetic factors involved in glaucoma.
Ah, yes. The genetics of glaucoma are a fascinating area of study. Scientists are using incredible techniques like proteome-wide association studies, TWAS, and transcriptome-wide association studies, TWAS, to understand how specific genes contribute to the disease's development.
Okay, those acronyms sound a bit intimidating. Can you break them down for us non-scientists?
Think of your genes as a blueprint that instructs your body how to function. Sometimes there are variations or glitches in this blueprint, and PWAS and TW act like powerful magnifying glasses, helping scientists pinpoint those specific genetic variations that might increase your risk of developing glaucoma.
So it's like they're zeroing in on the genetic culprits behind glaucoma. Are they finding anything promising?
Absolutely. One study identified a gene called GNLY, which appears to be significantly less active in people with glaucoma. What makes this particularly interesting is that GNLY plays a key role in immune regulation, inflammation, and apoptosis, the process of programmed cell death.
So if this gene isn't functioning properly, could it be contributing to the damage we see in the optic nerve?
That's exactly what researchers are exploring. By understanding the role of genes like GNLY, they hope to develop targeted therapies that address the root causes of glaucoma, not just manage the symptoms.
Wow. So instead of trying to control eye pressure, we might one day be able to prevent or even reverse the damage altogether.
That's the ultimate goal. Gene therapy is a rapidly evolving field, holding immense potential for treating a wide range of diseases, including glaucoma. We're still in the early stages, but the possibilities are incredibly exciting.
It's mind-boggling to think we might be on the verge of rewriting our genetic code to prevent this disease. But with all these advancements and different treatment options, how do doctors determine the best course of action for each individual patient?
It's definitely not a one-size-fits-all approach. Glaucoma is a complex disease with many subtypes, and the most effective treatment depends on a variety of factors. We're talking about the type and severity of glaucoma, the patient's overall health, their lifestyle, and even their personal preferences.
It sounds like a complicated puzzle.
Yeah.
How do doctors make sense of all those variables?
They're increasingly using what's called a multi-parametric approach. Instead of relying on just one or two measurements, they're looking at a broader picture to make the most informed decisions.
So what kind of parameters are they considering? Walk us through it.
One key factor is the thickness of the retinal nerve fiber layer, or RNFL. Think of it as the information highway between your eye and your brain. Thinning of the RNFL is a hallmark of glaucoma, so doctors use sophisticated imaging techniques to measure its thickness.
So the thinner the RNFL, the more damage is likely occurred.
Exactly. They also look at the number of retinal ganglion cells, those precious cells that make up the optic nerve. Again, they use specialized imaging to assess their health and count how many remain.
It's like they're taking inventory of the eye's vital components, seeing how much has been affected. What about the optic nerve itself? Can they actually visualize what's happening there?
Absolutely. They use a technique called ophthalmoscopy to examine the optic nerve head, which is where the optic nerve exits the eye. They're looking for signs of cupping, a characteristic indentation. That appears as nerve fibers are damaged and lost. They also examine the blood vessels in the area, checking for any abnormalities that might indicate problems with blood flow or oxygen supply.
It sounds like they're gathering clues from every corner of the eye to piece together the complete story of the disease.
That's a great way to put it. They also consider factors like the patient's age, family history of glaucoma, any other health conditions, and of course their eye pressure. All of these elements contribute to the assessment and ultimately guide treatment decisions.
It's a truly personalized approach, which makes sense. Everyone's eyes are unique, just like fingerprints.
You got it. And with all the advances we've discussed today, we're getting closer to a future where we can tailor treatments to each individual patient, maximizing their chances of preserving their precious vision.
It's like custom designing a treatment plan for each person's unique needs.
Precisely. And this multi-parametric approach isn't just about selecting the right treatments. It's about monitoring their effectiveness over time.
So it's not a one-time assessment. It's an ongoing process of observation and adjustment.
Exactly. Doctors use these parameters to track the progression of the disease, making adjustments to the treatment plan as needed to stay one step ahead of glaucoma and protect the patient's vision for the long term.
This is all incredibly fascinating, but I have to admit, it's also a lot to absorb. There's so many factors to consider, so many new technologies, and research is constantly evolving. How can anyone keep up with it all?
It can be overwhelming, that's for sure, but it's also incredibly exciting to see the progress being made. You don't have to become an expert yourself, though. That's where your healthcare team comes in.
So trust the experts.
Exactly. Your ophthalmologist, your optometrist, your pharmacist, they're your partners in this journey. They can guide you through the complexities of glaucoma, explain the latest advancements, and, most importantly, create a personalized plan that's right for you.
It's like having a team of specialists fighting for your sight. But even with the best medical care, it's clear that research plays a crucial role in pushing the boundaries of what's possible.
You're absolutely right. And there's one area of research I want to highlight that's providing some truly remarkable insights. Beyond all those high-tech scans and imaging techniques, there's something else that's proving to be even more revealing.
Okay, now you got me really curious.
Mhm.
What could be more revealing than all those sophisticated technologies?
Believe it or not, it's something we've all been doing our whole lives, looking at the world around us. But in this case, we're talking about a very specific way of looking, examining the microscopic structure of donated eyes after someone has passed away.
So we're talking about peering into the hidden world of the eye at its most fundamental level.
Exactly. Researchers are studying the tissues of eyes that have been affected by glaucoma, and they're able to see the damage in incredible detail, right down to the cellular level.
It's like getting a front row seat to the battle that's been fought within the eye.
That's a great analogy. By examining these tissues, they're gaining a deeper understanding of the mechanisms by which glaucoma causes damage to the optic nerve. They're looking at things like the loss of retinal ganglion cells, the thinning of the nerve fiber layer, changes in the supporting cells of the retina, and even the structure of the optic nerve head itself.
It's amazing to think that even after someone passes away, their eyes can continue to contribute to our understanding of this disease and potentially help future generations.
It's a true legacy of sight. And what's even more remarkable is that researchers are using this knowledge to develop new and more accurate grading systems for glaucoma.
Grading systems. Can you explain what you mean?
Traditionally, glaucoma has been graded based on measurements like eye pressure and visual field loss. But these measurements don't always tell the whole story. By studying the microscopic structure of the eye, they're able to identify subtle changes that might not be detectable with traditional methods.
So they're essentially developing a more nuanced language to describe the different stages and subtypes of glaucoma.
Exactly. They're looking at things like the loss of specific types of nerve fibers, the presence of inflammatory markers, and the extent of gliosis, a process where supporting cells in the retina become overactive and can actually contribute to nerve damage.
It's like moving from a blurry snapshot to a high-definition image of the damage, allowing for a much more precise diagnosis.
That's a great way to think about it. These new grading systems allow doctors to better assess the severity of the disease and tailor treatment accordingly, giving them a powerful tool to fight glaucoma more effectively.
With all these advances in diagnosing and grading glaucoma, what does the future hold for treatments? Are we on the verge of a cure?
That's the question everyone is asking. And while a complete cure might still be some way off, the progress we've made in recent years is truly remarkable. Research is focusing on a number of promising avenues, all aimed at protecting and even restoring vision.
So let's talk about those exciting possibilities. What are researchers working on right now?
One area of intense research is neuroprotection, finding ways to shield those precious retinal ganglion cells from damage and potentially even regenerate lost cells. Instead of just managing eye pressure, we might one day be able to repair the damage that's already been done.
Now, that would be a game changer. What kind of approaches are they exploring?
Scientists are investigating a variety of cutting-edge techniques, including gene therapy, stem cell therapy, and the use of specialized molecules called neurotrophic factors. These neurotrophic factors act like a nourishing elixir for nerve cells, supporting their growth, survival, and proper function.
Okay, those all sound promising, but can you unpack them a little bit for us?
Gene therapy, as we touched on earlier, involves introducing healthy copies of genes into cells to replace faulty ones. In the context of glaucoma, this could mean replacing genes involved in protecting nerve cells or promoting their survival.
So it's like correcting a glitch in the eye's software, ensuring those vital nerve cells have the instructions they need to thrive.
Exactly. Stem cell therapy, on the other hand, involves utilizing special cells that have the remarkable ability to transform into various cell types in the body, including nerve cells. The idea is to introduce these stem cells into the eye where they could potentially replace lost retinal ganglion cells or help repair damaged ones.
So it's like sending in a team of cellular repair specialists to rebuild the damaged areas. And what about those neurotrophic factors you mentioned? How do they fit into the picture?
Neurotrophic factors are like essential nutrients for nerve cells, helping them stay healthy and functional. Scientists are exploring ways to deliver these neurotrophic factors directly to the eye, where they could potentially slow down or even reverse the damage caused by glaucoma.
It sounds like a multi-pronged attack on glaucoma, addressing the problem from every angle. But are any of these treatments actually close to becoming a reality for patients?
While it's still early days for many of these therapies, some are already showing very encouraging results in clinical trials. For example, there are ongoing trials using gene therapy to deliver neurotrophic factors to the eye, and the early findings are definitely promising.
So this isn't just a distant dream, it's starting to become a tangible possibility.
That's what makes this field so exciting right now. There's a real sense that we're on the cusp of major breakthroughs. As research progresses, we can expect to see even more advancements in the coming years. It's a time of great hope and possibility for those affected by glaucoma.
This has been an incredible journey so far, but I feel like we're just scratching the surface of this vast and complex topic.
You're absolutely right. We've covered a lot of ground, but there's still so much more to explore. And that's what makes glaucoma research so compelling. It's a constantly evolving field, with new discoveries and advancements happening all the time.
It's like opening a door to a whole new world of understanding.
And this is just the beginning. There's so much more to come. It really is an incredible time to be involved in glaucoma research. We're seeing advancements in every aspect of the field, from diagnosis and monitoring to treatment and prevention.
You've given us so much to think about. But before we wrap up this deep dive, I have one last question that's been on my mind. We've talked about all these incredible technologies and treatments, but what about those folks who are struggling to access quality eye care? Not everyone has access to the latest advancements or specialists like Professor Sarwar.
That's a crucial point, and it's something that weighs heavily on the minds of many researchers and healthcare professionals. Access to quality eye care is a global challenge, and it's especially pressing in low-resource settings.
It feels like a cruel irony, doesn't it? Glaucoma disproportionately affects people in developing countries, yet they often have the least access to the care they need.
It's a heartbreaking reality, but there are dedicated individuals and organizations working tirelessly to bridge this gap, developing innovative solutions to bring eye care to underserved communities.
Can you give us some examples? What kind of initiatives are making a difference?
One approach is to train and empower local healthcare workers to provide basic eye care services. Imagine equipping nurses and community health workers with the knowledge and tools to screen for glaucoma and provide early interventions.
That's a fantastic idea. It's about building capacity within communities to address the problem from within.
Exactly. There's also a growing movement towards telemedicine, leveraging technology to connect patients in remote areas with eye specialists in urban centers.
So even if you're miles away from a specialist, you can still benefit from their expertise through virtual consultations.
That's the power of technology. And there are some incredibly innovative portable devices being developed that can provide sophisticated eye exams in even the most challenging environments.
Wow, that's inspiring. It sounds like we're witnessing a real shift towards making eye care more accessible and equitable.
We are. And it's not just about technology. It's about collaboration, education, and a commitment to ensuring that everyone, regardless of their location or socioeconomic status, has the opportunity to protect their vision.
What a powerful message of hope. It's a reminder that even in the face of complex challenges, there are people working tirelessly to make a difference. And you know, as we wrap up this deep dive, I can't help but feel a surge of optimism. We've covered so much ground, from the intricacies of the eye's plumbing system to the cutting-edge therapies that are revolutionizing treatment.
It's been an incredible journey, and I hope our listener feels empowered by this knowledge, equipped to ask the right questions and advocate for their own eye health.
Absolutely. Knowledge is power, and understanding the complexities of glaucoma is the first step towards taking control of your eye health journey. But before we say goodbye, let's leave our listener with a final thought. Something to spark their curiosity and keep them exploring this fascinating world.
I like it. Let's challenge them with this. Imagine a world where routine eye exams are as commonplace as visiting the dentist. What would it take to make that a reality, and what impact would it have on the fight against glaucoma?
Wow, that's a powerful question. It really gets you thinking about the possibilities. If we could make eye care a priority for everyone, we could potentially prevent countless cases of vision loss and improve the lives of millions.
Exactly. It's a goal worth striving for, and it all starts with awareness, education, and a commitment to making eye health a fundamental part of our overall well-being.
Well, on that inspiring note, I want to thank you for joining us on this incredible deep dive into the world of glaucoma. It's been an eye-opening experience, to say the least.
The pleasure was all mine. It's been a privilege to share this journey with you and our listener.
And to our listener, thank you for being such a curious and engaged learner. We hope this deep dive has given you a newfound understanding of glaucoma, its challenges, and the remarkable progress being made in research and treatment.
Remember, you are not alone in this. There are countless resources available to support you, and a whole community of experts and fellow learners ready to help you navigate this journey.
And if you ever find yourself craving more knowledge or needing a refresher on any topic, you know where to find us. We're always ready for another deep dive.